Leg pain is a universal affliction, experienced by everyone at some point. It is not merely a fleeting discomfort following an exhausting day or a sharp sensation that arises after a sudden movement. For many, this pain is more than a temporary nuisance. It is a constant presence, a shadow that insists on disturbing daily life. Although common, leg pain is surprisingly complex, with multifaceted causes often hidden in the intricacies of our bodies. It may result from simple muscle strains or indicate more severe conditions, making diagnosis a true challenge. The source of discomfort is not always easily identifiable, and the variability of symptoms only adds to the complexity. The pain can be sharp or merely bothersome, persistent or sporadic, localized or diffuse, affecting one or both legs. This broad spectrum of manifestations makes seeking medical help imperative. An accurate diagnosis is the first step toward effective treatment and relief. The origins of leg pain are varied. Joints, the points of connection between our bones, are often to blame. Arthritis, characterized by joint inflammation, can cause ongoing pain, stiffness, and swelling. Osteoarthritis, a degenerative form of arthritis, commonly affects the knees and hips. Our circulatory system, this intricate network of blood vessels, can also be at the root of the problem. Arteries, tasked with transporting oxygen-rich blood away from the heart, can narrow or become blocked, a condition known as arterial insufficiency, which limits blood flow to the legs and causes pain, especially during physical activity. Veins, responsible for returning blood to the heart, can also contribute to discomfort. Venous insufficiency occurs when veins struggle to pump blood back to the heart efficiently, which can result in varicose veins, swollen and twisted veins visible under the skin, accompanied by throbbing pain. Take, for example, Sarah, an enthusiastic marathon runner whose training was interrupted by persistent calf pain. Initially dismissed as a mere muscle strain, the pain worsened, accompanied by swelling and skin discoloration, culminating in the diagnosis of deep vein thrombosis, a blood clot in a deep leg vein, a serious condition that requires immediate medical attention. John, a retired gentleman, faced increasing hip pain that hindered his mobility. Over time, the pain intensified, affecting his sleep and mobility, until the diagnosis of osteoarthritis, a degenerative joint disease. The treatment involved pain management, physiotherapy, and eventually hip replacement surgery. These accounts underline the diversity of leg pain and its significant impact on quality of life. Pain can signal a minor issue or a serious medical condition. Understanding the range of potential causes is vital for seeking appropriate medical care. Leg pain, a universal ailment, is a common experience for humanity. It is not confined to transient discomfort after a taxing day or a piercing sensation that arises with an unexpected gesture. For many, it represents more than a fleeting inconvenience. It is a constant presence, a shadow that insists on clouding existence. Its frequent occurrence disguises a deceptive complexity, with diverse origins often hidden in the sophisticated mechanics of our bodies. It may stem from trivial muscular tensions or herald serious illnesses, making diagnosis a laborious process. Identifying the source of discomfort is not always obvious, and the variability of symptoms increases complexity. The pain can be penetrating or subtle, constant or episodic, confined or diffuse, affecting one or both extremities. This vast symptomatic spectrum underlines the importance of seeking medical guidance. An accurate diagnosis is crucial for effective treatment and pain relief. Leg pain can arise from multiple sources. Joints, the points of union of bones, are often responsible. Arthritis, marked by joint inflammation, can cause persistent pain, stiffness, and swelling. Osteoarthritis, a degenerative form of arthritis, primarily affects the knees and hips. The circulatory system, a complex network of blood vessels, can also be the source of the problem. Arteries, which carry oxygenated blood away from the heart, can narrow or become obstructed, a condition known as arterial insufficiency, restricting blood flow to the legs and causing pain, especially during exercise. Veins, tasked with returning blood to the heart, can also be a factor. Venous insufficiency, when veins struggle to pump blood back to the heart efficiently, can result in varicose veins, dilated and twisted veins visible under the skin, accompanied by throbbing pain. Consider Sarah, a marathon runner whose preparation was interrupted by persistent calf pain. Initially downplayed as a muscle strain, the pain intensified, with swelling and skin discoloration, leading to the diagnosis of deep vein thrombosis, a blood clot in a deep leg vein, a serious condition requiring immediate medical attention. John, a retired gentleman, suffered from increasing hip pain that hindered his walking. Over time, the pain worsened, affecting his sleep and mobility, until the diagnosis of osteoarthritis, a degenerative joint disease. The treatment involved pain management, physiotherapy, and eventually hip replacement surgery. These cases illustrate the diverse nature of leg pain and its impact on quality of life. Pain can indicate a minor problem or a serious medical condition. Understanding the spectrum of possible causes is essential for seeking appropriate medical care. The diagnosis of leg pain requires a multifaceted approach. Physicians assess the patient's medical history, lifestyle, and specific symptoms. Physical examinations measure the range of motion, sensitivity, and signs of swelling or inflammation. Imaging tests, such as X-rays, ultrasounds, or MRIs, provide detailed views of bones, joints, and blood vessels, revealing fractures, arthritis, blood clots, or other underlying structural abnormalities. Blood tests can also identify infections or inflammatory conditions that contribute to leg pain. An accurate diagnosis is crucial, as it allows for targeted treatment, addressing the root cause of the pain. An incorrect diagnosis can result in ineffective treatment, prolonging discomfort and potentially worsening the underlying condition. Ignoring leg pain can have serious consequences. Untreated arterial insufficiency can lead to critical limb ischemia, a severe blockage of blood flow that can cause tissue death and potentially require amputation. Untreated deep vein thrombosis can result in pulmonary embolism, a potentially life-threatening condition where a blood clot travels to the lungs. Even seemingly minor leg pains, if untreated, can evolve into chronic pain, disrupting sleep, limiting mobility, and causing emotional distress. They can impair daily activities, making it challenging to work, exercise, or engage in hobbies. Early diagnosis and treatment are crucial for preventing complications, managing pain, and maintaining a good quality of life. While not all leg pain is preventable, certain lifestyle changes can reduce the risk. Maintaining a healthy weight alleviates pressure on joints. Regular exercise, including low-impact activities like swimming or cycling, strengthens muscles and improves circulation. Proper footwear provides support and cushioning, minimizing stress on feet and legs. Avoiding standing or sitting for extended periods promotes healthy blood flow. Adequate hydration is essential for overall health, including muscle function and circulation. These preventive measures can significantly reduce the risk of developing certain types of leg pain. Leg pain is common, but it should not be ignored. Understanding potential causes and their implications is empowering, allowing us to make informed decisions about our health. Do not hesitate to seek medical attention if you experience persistent or increasing leg pain. Early diagnosis and treatment are essential for effective pain control and the prevention of long-term complications. By being proactive and seeking medical guidance, we can take control of our health and ensure that our legs remain strong and healthy for many years.